Welcome to the Mental Health Merienda, your snack-sized guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker.
So today we wanted to do a video. It's a little different from what we've been doing recently. We wanted to discuss different kinds of mental health professionals. There are a lot of them, and it could be really confusing. Some prescribe medications, some don't. Some do psychotherapy. Some are called doctor, and some aren't. I think it causes a lot of very legitimate and understandable confusion. So we're going to go through some of that and explain a little bit about what different professionals do and what their roles are.
Sounds good. So I think an easy way to understand all these different professional roles is to kind of group some of them. So we'll group it by professionals who prescribe medication and then professionals who don't prescribe medication. So starting off with those mental health professionals who do prescribe medication, we'll start off with a psychiatrist. That's probably the one that most people are aware of and most people hear about. So a psychiatrist is a medical doctor. So they have an MD or a DO. They went to medical school, all that time spent in medical school. And a psychiatrist's role is to prescribe medicine. Sometimes they don't, if they don't think you need it, but they're able to prescribe medicine. That's why you see them. They also, they do prescribe medication, they'll usually follow up with their patients about like every 3 months. So oftentimes you're not seeing your psychiatrist every week like you might be with other professionals. Appointments with psychiatrists are a lot shorter than, a therapy appointment. Usually it's about, 15, 20 minutes because the focus is on medications, and they usually don't provide psychotherapy. Some do, but most traditionally don't because another person will kind of handle that role because they're more focused on prescribing medication.
Yeah, and I think that's really helpful information to know about psychiatrists is I'll have patients a lot of times who say that, oh, I saw this doctor, but I don't know, they only talked to me for about 10, 15 minutes. And all they asked me was if I have side effects to my medications. And so I think sometimes that can be a bit of a confusion. Psychiatrists used to be trained way back, 20, 30, 40 years ago, back, if you're familiar with Sigmund Freud, kind of like that kind of psychotherapy modality, but they don't tend to do psychotherapy now. But another type of professional who prescribes medications is a psychiatric nurse practitioner. So they can have either a master's of science in nursing, so they're an advanced practice nurse, or they can have a doctorate of nursing. So the Master's of Science would be an MSN, and if it's a doctorate, it's a DNP. The ones who have the DNP are referred to as doctor, and the ones who have the master's are not. You would typically probably call them by their first name. And so they follow a very patient-centered model of education and practice. So what they do is that typically before they even enter the graduate level training, they already choose a specialty right out of the gate. And so they might say, okay, I want to be a psychiatric. We could be different kinds. You could be family practice. You could be a neurology nurse practitioner. But if you decide to go into psychiatric, you would enter into a program already just completely focused on psychiatric nurse practitioning. And so with that, they focus on medications. And in many practices, they can spend longer with patients, and then they can incorporate some limited therapeutic techniques, again, because their training is more patient-centered. And so, if you see a psychiatrist, like Michelle said, it would be maybe 15 minutes or so, 10, 15 minutes. You might have an appointment with a nurse practitioner who's also following up on medications, but the appointments with them might be closer to 20, 30 minutes, and they can actually incorporate just a little bit of psychotherapy in their appointments.
Yeah. And sometimes too, depending on the medication regimen of a client, they might also kind of be working with a psychiatrist or kind of working under a psychiatrist as well. So there's also that dynamic that plays out with nurse practitioners. And then another professional that can prescribe medication is a psychiatric physician's assistant. So they also work in collaboration with a supervising physician, like a psychiatrist, but not necessarily under their direct supervision, but they usually work, together with a physician. They're not doctors, so they're master's level. But again, their education is more focused on general medicine and disease center and medication. So they follow that kind of medical model as, a med student would also follow. And like a nurse practitioner, they also specialize in different field. So like psychiatry or psychiatric, in the psychiatric field, like a psychiatric nurse practitioner, for example. There's also like family practice and other types of specialties. But if they choose that specialty, that's what they're going to be focused on. So if they are a psychiatric physician's assistant, then they're going to be focusing on that specialty.
Yeah, so I think the big difference between a PA, a physician assistant, and a nurse practitioner is that even though they both specialize, the physician assistant, their training and their schooling is more of a broad medical schooling, more like medical school first, and then they specialize afterward after they have their degrees. Versus the nurse practitioner, they specialize before they earn their degrees.
So I think the key here with these, professionals who can prescribe medication is that, your psychiatrist is, a medical doctor. For nurse practitioner, there is the DNP, so that person is going to be also a doctor. But then your nurse practitioner, your physician's assistant, those are going to be your master's level practitioners who can prescribe medication. They're fully trained to do so, but that's essentially what the difference is when you hear those professional titles. Those are the professionals that can prescribe medication. Now let's get into the professionals who are not going to prescribe medication. So with the professionals who are not able to prescribe medication, just something to know broadly about these professions is that, training is going to be focused on clinical work, including different types of psychotherapy. So we talk a lot about CBT, which is cognitive behavioral therapy. We talk about psychodynamic, interpersonal, et cetera, all the different types of psychotherapy modalities. And there are licensing requirements. Actually, there's licensing requirements with psychiatrists and nurse practitioners and physician's assistants as well. Same with us who are, not able to prescribe medication. We are also licensed, and we have that, governing body that's dictating to make sure that we're doing our job, we're following all the right things, that, we're not harming patients and clients, and that we are providing, ethical services.
And so to start off, that list is a psychologist, so a licensed clinical psychologist, which is what I happen to be. So psychologists are referred to as doctor. You might see some psychologists that have a PhD after their names, like I do, or you might see some who have PsyD after their names. There's not really a big difference between them. They both have doctorates. They're both referred to as doctor. They're both considered psychologists. The only difference is a slight difference in their training, where the PsyDs, they actually have a doctorate in psychology. So it's a more clinical degree focused on clinical training in psychology. And then the PhD, it would be technically a doctorate in philosophy specializing in psychology. And so with the PhD, it is a bit more of a research degree. When you're seeing someone for clinical work, it doesn't really make a difference if someone has more research experience or teaching experience than someone else. You just might see PhDs that they are also involved in research and teaching in addition to doing clinical work. So they're more likely to work at an academic medical center, because you do tend to be involved in all three of those in an academic medical center. But in a clinical setting, it really doesn't make a difference. One significant difference between psychologists and master's level therapists, which Michelle will be speaking about in a minute, is that they can both do therapy. It's not that a master's level therapist is less qualified to do therapy. I really want to emphasize that, because I think that's a misconception that a lot of people have, and they say, "Oh, I want a therapist, but I want a psychologist. I don't want someone with a master's." They're just as qualified. It's one big difference from a clinical perspective is that a psychologist is also able to do testing. So either psychological testing, if there's a question of, does this person have bipolar disorder or ADHD or generalized anxiety disorder, or neuropsychological testing, which is what I do. So if there's a question of whether someone might have cognitive impairment related to a brain injury, related to dementia or seizures or whatever it might be. So that's one differentiation. So if you're seeing a master's level therapist for psychotherapy and they're not very clear on your diagnosis, they can refer you to a psychologist to just do the testing part to help clarify the diagnosis. And then when they go back to the treatment with you, then it kind of informs their treatment a little more. Just to mention one little caveat to everything that I just said with psychologists not being able to prescribe medications is that in a few states, they actually can with an extra certification. and an extra kind of training where they're able to prescribe medications. That's a fairly recent development, so you're not as likely now to find as many, but I do think that in the future, you'll likely find a few more psychologists who are able to do that. In the state where I happen to live in Florida, that's not something I believe that they're able to do, but in a lot of states, that is an option for psychologists.
Yeah. Yeah, in California, I believe that's also not an option. But I think sometimes that also has to deal with like availability of practitioners, and in some places that maybe are more rural, you don't have a lot of options. So
Yeah.
that's sometimes the reason for it.
Mm-hmm. Yeah.
So we also have master's level therapists, as Adeline had mentioned. So the names you'll hear would be licensed clinical social worker, or LCSW, like myself. There's also licensed marriage and family therapists, so LMFTs. And then in some places, we also have licensed mental health counselors, and they could be like LPCCs or LMHCs, all these acronyms, but licensed,
LPC, yeah. Mm-hmm.
yeah, licensed professional counselors or licensed clinical counselors. I think it's kind of like all in the same vein. We're master's level therapists who can provide therapy, and we're trained to do so. So a couple things to keep in mind with master's level therapists. So minimally, we complete 2 years post bachelor's education. So 2 years of graduate school focused on, licensed clinical social work or marriage and family therapy. And in some cases, it's even a master's in psychology. And part of the training includes interning while we are in school. So we are going in clinics and hospitals and seeing patients and working under the supervision of someone who's licensed, or even maybe a licensed psychologist, or maybe a psychiatrist even, to get that training and to get that, in-depth, client interaction, and how do we deal with these like real life scenarios. And then also once we graduate, we have like two years of having to obtain hours before we can even take a licensure test. So there is a lot of training, a lot of like on the ground, in the field training, seeing patients, and then going back and talking about those patients in supervision. So that's also part of the training, and just something for people to know in terms of, what does it look like to see, a master's level person.
And even, I think when you mean hours, you mean face-to-face hours with
face-to-face
clients.
client hours. Yes.
Mm-hmm.
Thank you. Yeah. Mm-hmm. To make that distinction. So there is a lot of, training that happens in terms of like, if you're going to see a therapist, just know that all that training is happening before that person can say that they're licensed in any of those professions.
So even though this episode is focused on different mental health professionals, and because there's a lot of them, and the ones that can and cannot prescribe medications, this is not meant to be an exhaustive list, especially depending on what state you live in. And most definitely, if you don't live in the United States, it could be quite different from this list, actually. But I also wanted to mention at the end of this episode, life coaches, which we've mentioned a few times, and just a clear distinction between a life coach and some of the other, or all the other professionals that we've mentioned so far. All the ones we've mentioned so far are licensed. So as Michelle mentioned earlier, there is a licensing board for myself and for Michelle, and we each have to answer to this governing body. And so if any one of us were to do something unethical, in our treatment of a patient, there is that licensing board, and there's always the risk of having us lose our license. Also, with having a license, you have continuing education units, CEUs, that you have to obtain. That means that even if someone earned their degree, let's say in 1985, it doesn't mean that they only have the information they learned back in their schooling in the 1980s. You have to have updated hours. So you have to do readings, go to conferences and different talks, and you have to earn those hours in order to update your license, because your license expires depending on the profession, it could be every year, every 2 years. But you need to do those hours in order to obtain your license and to have it renewed.
And one more thing too is that for us to even apply to get a license, there's requirements that we have to fulfill. We have to have certain education requirements. So that's also something that's nice about, licensed professionals, is that you know that they had to meet certain education expectations, certain training requirements before they can even apply for the license. And then, as Adeline said, to maintain the license is a whole nother set of requirements that all of us have to follow.
So to contrast that with a life coach is not licensed. So there's no governing body. You take some courses, you have some information that you read about how to do different, how to help people through different conflicts and things like that. So if you are already seeing a life coach and thinking, oh, okay, maybe I should stop seeing this person. The thing about a life coach is that they cannot diagnose any mental health disorder. If you have concerns about having depression or anxiety, that is not something that a life coach is qualified to do because they're not licensed. If, for example, you needed some advice on, what career to choose, or, should I be at this job or not, or kind of advice like you would seek from a friend, that's something you can get from a life coach. But really, when it comes to any kind of mental health treatment, that is not anything that a life coach is qualified to do.
Yeah. Yeah. So just some things to keep in mind. Yeah.
Mm-hmm.
All right. So that's all we have for today's show about all the different types of mental health professionals in the field. Hopefully this is useful to all of you. Again, my name is Michelle Young, licensed clinical social worker.
And I'm Dr. Adeline Leon, licensed clinical psychologist.
Thanks so much for tuning in to Mental Health Merienda, your snack-sized guide for mental health information. If you've ever seen any of these professionals before, let us know in the comments. We'd love to hear from you. And don't forget to like and subscribe for more videos like this.
Thanks. Bye.
Bye.